Welcome back to the today's session. Today's speaker, sir, name is Dr. Sujit Singh Makkar, sir. Sir is a renowned veterinary homeopath. And coming on to the brief introduction of the sir, sir has did BBSc and AH, MSc IT, MCA, MF Homeopathy, member faculty of Homeopathy, Malaysia, DTS, Director of Trainers Skills. Sir has a professional experience in veterinary homeopath, delivered holistic homeopathic treatments globally with a focus on personalized care for each animal, consulted on complex veterinarian cases, providing expert guidance and innovative solutions. Sir has also got a free online veterinary homeopathy treatment worldwide through www.vethomeopath.com since the year 2000, awarded the Rashtriya Gaurav Award by IIFS India for outstanding contributions to veterinarian homeopath and public service. Sir has presented many papers in various conferences. We are glad to have you, sir. We welcome you, sir. We welcome all the participants also. By the way, the session is hand over to you, sir. Thank you, sir.
Thank you, dear friends. So, if you can start and share our screen.
Yes, sir. You can share your screen, sir.
Screen. Share screen. Start now.
Yes, sir. Please continue.
So, thank dear friends. Today I'm going to talk about veterinary homeopathy, which is a medicina futura. And so today we are going to talk about the integrative veterinary medicine, the role of homeopathy in shaping the future of animal healthcare. So how we take the case and how we apply the case, that is very, very important in veterinary homeopathy. And this is very important how to take the case. Because in simple terms, if you take the case normally, you have to take every time, you can say normal symptoms and all the things. So this is like in veterinary homeopathy also. So every time when we take the case, we have to find LACM, that is location, etiology, concomitants, and modality. And when we find the symptoms, every time we have to find PQRSU symptoms, that is peculiar, peculiar, rare, uncommon symptoms. Then we are supposed to then we have to take the totality of the symptoms. Then we are supposed to repertorize the case. Then only we can find the simillimum. In our animals, the case taking is somewhat difficult, you can say. But when you observe, if you observe very carefully, during our degree of 5.5 years of a veterinary science, we are being taught like this: we have to observe our animal. We have to extract the symptoms from that animal. Every time we have to check what is our animal is behaving like that. Okay, so we are being trained during our degree to how to observe animal, how to diagnose the diseases by observing, and we have to take the help of other means also. So, dear friends, today we discuss. So, as you know very well, principles of veterinary homeopathy we apply everywhere, like yours, like enhancing self-healing, individualized treatment. Yes, this is the main thing. So we have to take each and every animals. I'm audible now. It is okay. Hello.
Yes, sir. You are audible, sir. We can hear you, sir. Yes, sir.
Okay, it is good going on. Okay.
It's going well, sir. Yes, sir.
Okay. So we have to take this, as you know very well, homeopathy is a individualized treatment. So every time we have to take the case individually. You can't say if we have treated one case of suppose I have treated one case of rectal prolapse, which is published in international journal. So in that we have given some of the medicines like CPR and we have given Ruta. And this is not in every case we have to give CPR and Ruta. No, every time we have to find the individual symptoms. We have to find the constitution of the animal. Every time we have to find LACM. Every time we have to find PQRSU symptoms. Then we can only reprise the case and then we can only find the simillimum. That is the main issue. Okay. So integration with the conventional medicine, we can integrate our homeopathic medicines very well. With sometimes people are asking in the field clinicians if we can give homeopathy along with our antibiotics. Yes, we can give, but we should avoid them. But we can, if the situation persists like that, we can give. Then where we are using homeopathy, and there are a lot of cases where it is very, very successful, like skin conditions, gastrointestinal issues, respiratory issues, behavioral disorders. The very, very good homeopathy is working wonders in some behavioral disorders. Nowadays, our pets, they have a lot of anxiety in them. There are a lot of depressions in them, there are a lot of issues with behavior problems. Every time out of the, if I receive 10 cases out of the 2 cases out of the 10, they are rated with the behavior problems. So we have to tackle, and homeopathy is the best ethical way of treating these behavioral disorders. So we in practice, we also use for these chronic conditions. They are very well covered with sun. We used for the surgical recoveries, and we also use this homeopathy for sometimes with the for prevention care. So advantage of veterinary homeopathy, as you know, there's a minimal side effects. It has a holistic approach. Then it has a preventive potential, and we have proved it that it has a preventive potential. So this is a case, particularly I will make you know how we take the case and how we reprise the case, and then how we give the medicine to a case. Now this parrot was come to us, and according to the this has problems of the GIT issue. This has problems with other issues also. It was vomiting. It was have some diarrhea also. It was being treated by some other people, other vets also, but it doesn't respond to anything. And this parrot was came to me since I'm a freelancer in the world to give the treatments. So this patient comes to me. This parrot is from Gujarat state. So he's just saying when he starts telling me the symptoms, he told me a peculiar symptom. That is the PQR symptom. That is, before falling ill, the parrots want to remain outside the cage, and after it becomes sick, it doesn't want to come outside the case. You know this thing. Yes, this is very, very good point. So this is how we take the case in veterinary homeopathy. Every time we have to find the PQRSU symptom, that is peculiar, cure, rare, uncommon symptom. So what is the PQR symptom over here? The parrots want to remain outside of the case, but after becoming ill, after becoming sick, now it doesn't want to come outside case because he's afraid of coming outside. He may be fear of death. He's also restlessness. So main rubric of the case. So this is how we take the rubrics of the case, Then we repertorize the case. We have repertorized the case in the West Repertory. We have taken the mind symptoms. We have taken anxiety, restlessness with. We have taken respiratory system, asthmatic breathing, restlessness with. Then we have taken some mind symptoms from Boeing-Hassan repertory, and the notes of the key notes of this Boeing-Hassan. They are good for veterinary practitioners. Veterinary homeopathy practitioners, we almost use Boeing-Hassan repertory. Okay, so over here, the fearsome, anxiety, dread, frightened easily, anxious, restlessness, fearsome. Okay, so then we have 8 rubrics over here. So then we have again thirst rubric, thirst, vomiting after. In Boeing-Hassan again, nausea and vomiting, inclination to vomit extra. Then in the vet repertory, that is written by me, that is generalities, that is fever in general. So we have taken these 8 rubrics and we go 22 points in arsenical, in aconite 19 points, in murk salt 17 points. But over here, since we have taken 22 points out of 8 rubrics, and there's a prominence for this arsenical, as it is GIT problems are there, then restlessness is there, and the parrot doesn't want to come outside the case. Is a totally restlessness. So this is how we have taken the case and we have reported the case. So in simple terms, we have given arsenical twice a day, and the parrots recovered like anything. Miracles with the parrot. Its asthenia has gone, its fever has gone, there's no vomiting. All the problems have been vanished within 3 days of giving this treatment. So this is how beautifully this homeopathy works wonders. So this is just another case. I will make you go through some of the cases. So this is a case of a turtle. So nowadays, what is happening? People are keeping these small turtles in their house in fish aquarium. In the same way where they are keeping fishes, now they are also keeping these small turtles with them. Okay. Now over here, what is the problem over here? The owner of the animal has reported to he's from Mumbai, and he has reported that there are some skin issues with the turtle. This is skin. This is a cold. This is a you can say, and this is the extended part of the skin, and it is oozing some gelatinous fluid from here. You see from here, these are cracks on the skin, on the overall body of, you can say like that. This hole is a extended part of a skin. So there is a gelatinous fluid that is coming outside. You see from here. There are cracks on the skin, and these are gelatinous fluid that is coming outside from these cracks. So it has fissures and cracked. So we have reported the case again over here. We have taken mind symptoms from the boric, mood, disposition, melancholic, disposant, depression. Then we have taken some skin conditions from the vet repertory, that's cracks, fissures. Then we have taken the Boeing essence, some skin exterior body cracks, fissures, chaps. Then we have taken all these symptoms into account, and we have taken only these 3 rubrics into account. And with graphites, and it is oozing gelatinous fluid from the cracks. So clear-cut indication of graphites. If we have used nitric acid, it will not work over here, because in nitric acid, if there's some cracks are there, it works on there's a mucoskeletal junction is there. So that's why since it is oozing gelatinous fluid from the cracks, So we have given graphite, and the animal recovered like anything. You see, the word of the owner of the turtle. So our both turtles are very fine now, taking foods regularly. Their energy level improved, and now they not lethargic, and now sleepiness is there. So they have worked very well. Okay, so this is my second case. So I have been given this case from yes, this case is from Kolkata. Yes, this is case of a Mega. She's nowadays she's living in Bombay. Otherwise, she's from Kolkata. So she has given this case. She has a cat, and it started. There is a prolapse of rectum in this case over here. So she was very afraid of, and she has become very, very nervous, and then she has gone to a vet, and they have advised some surgery on that. But she doesn't prefer surgery, and she searched me over the net, and then she come to me, and on the phone we have conversation, and she has let me know all the symptoms, and we have repertorized the case. So she has given me these symptoms, like there's a prolapse of the rectum, any rectum and anus, prolapse of rectum, Boeing Hassan. Then we have concomitants during stool, anus, rectum, prolapse of. So we have taken these 5 rubrics into account, and CPI is number 1, where we have given CPI over here, and with the CPI we have given also Ruta over here, because Ruta is the medicine which works on the ligaments. So whenever there's a problem like this, there's a prolapse of the uterus or prolapse of the rectum. So there is always a problem of the ligaments also. So we have complement this CPR with the Ruta, and this is after treatment. This is very, very good case, and it has been published in International Journal of High Delusions. Okay, so this is a cat now. Her prolapse, dehydration, breathing problems are completely fine. So this is the beauty of the homeopathy. While we every time we take the totality of the symptoms, we are not treating only for prolapse of the rectum. Now in this case, we have treated with her dehydration, her breathing. Okay, along with this prolapse. So this is the beauty of the homeopathy. We take the symptoms from head to toe. Okay. And then after taking the totality of the symptoms, we repertorize the case. And after we find the simillimum, then we give only the homeopathy medicine. So this is the case taking, or we take the case in veterinary side. So this is a very, very, again, a cough case of a whooping cough. This is a very, very, you can say, very, very complex case. This lady is from Uttarakhand, and she's from Dehradun, you can say like that. So this dog has a lot of issues with it. Since it has issues, long-standing cough, whooping cough, since 3 years back. And it is not being covered by any allopathy with a lot of, she has gone to every vet over there. And she has even gone to some homeopaths in that area also. And probably they have given only this, the indicated medicines in cough, like whooping cough, like they have given Spongia tosta, they have given some this Prosra, they have given Brania, they have given in high potencies, 1M, 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 Prosra, Spongia tosta. But this animal is not responding. So when I took this case, so I take the history. In our veterinary side, the history is very, very important. So every time when we take the case, we take the history in a proper way. So while taking the history, I come to know that this animal is in this dog is in a position of a see from here. No. Okay. So this patient is in a condition of a mourning. Okay, because it has gone for mourning because it's one of his companion has died. And when his companion has died, one year ago, it started coughing more and more. It starts retching also. Okay. So there's a continuous cough. Okay. So in order to find all these symptoms, we have reported the case, and we have taken the PQRS symptom, that is moaning. Okay. That is with the animal. The problem has started after the death of his companion. It has gone in the moaning state. So we have find the best medicine, and we have taken these rubrics over here. You see over here. So there are a lot of rubrics which we have taken, like continuous cough, like this. There's a retching of cough. There are a lot of rubrics we have taken. Then almost there are nine rubrics which we have taken. So when we have revised the case, we come to know that the medicine will be coral, the deepest medicine that is found in the you can say the deep sea, that is coral rubrum. Over here we have given coral rubrum, and animal recovered completely. So this is how we can take the case, and sometimes if we have a lot of time, and if we I give you the idea of this case, it will take a long time, because we have less time, and I want to show you more and more cases. So so this is how we have reported the case, and we have cured this case with wonderful results with coral rubrum. So this is after treatment, and the animal is very happy with our this with the miracles of the homeopathy. So again, this is one case of a pet. This is a very small pup, and after the, since it was overcome by a car accidentally, it was sleeping under the car, and when the owner of the car comes, and it started driving the car, and he doesn't know the pet was underneath his tire of the car. So it ultimately its pelvic completely broken. It had started. They have left any hope. So this is very small pup, and they have gone to some vet, and they show that this is going to be some pelvic injury, and it should go for some operation. But the since it was a stray dog, so some of the NGOs over there, they have quoted me. This is the Suchi from Jabalpur, MP, India. So she has given me, she has sent me the reports of this case, and this is the condition of the pup before treatment. Okay, so we have taken all the rubrics, and we have reported the case, and we have done everything, and we have taken all these rubrics into account. That is fear from the wet respiratory, then external injuries, then skin and exterior body wounds. Then we have taken all these 6 rubrics, and over here we have given arnica. Okay, and after giving the arnica, the miracles have covered, and this is after treatment. So this is, dear friends, this is how our homeopathy works wonders. So this is the position. This is after arnica. You see position from here. It is pelvic. You can't say it covered it within 2 days or 2 weeks. It has taken 2 months together to complete this complete treatment. Even 3 months you can select that. After 1 month it has responded. Then after 2 months it is almost okay, and after 3 months it is 100% okay. So this is how we have given this treatments. Okay, so this is owner words. Sir, she's very fine now, taking foods very well. The homeopathy medicine are working like magic. Now I believe that homeopathy comes to the rescue when other systems of medicine cease to work. Homeopathy is right choice for humans as well as animals. So this is again a case of a cat. So over here, the problems over here is this cat has a tumor, wart over here, tumor-like structure, like wart. You can say like it is wart-like structure on her nose tip. Okay, you see from here. Okay, then after taking the case, after rotating the case, the first remedy of choice is acid nitricum. As you know, old people very well, that whenever there is a musculoskeletal junction, whenever there is any wart-like structure on the musculoskeletal junction, it is always a acid nitricum. That's why we have given acid nitricum 200 over here, one dose, and after that, this is the starter progressing, and ultimately it has vanished completely, fallen off. You see from here, 1, 2, 3, nothing is there. So this is wonders of homeopathy, you can say like that. Again, we are treating so many type of cases, like as squamous cell carcinoma, in which is this is before and this is after. So this is how we are. We have no good time to. Again, this is a demoticosis case. I want to show you this thing. This case was presented to us like this. She has lesions on his face, and these are lesions with alopecia of the lateral sides. Okay, so we have taken the case, we have revised the case. So we have taken the totality of the symptoms. We have taken skin and exterior body, itch, scabies itch. Then we have taken itching. Then we have taken discharges purulent. So the medicine comes over here is sorinum. So we have given sorinum. Okay, and this is before therapy, 0 day. On the lateral side, day 14, day 28, day 42. There is a complete recovery after 42 days. So this is how homeopathy works, wonders. Now on the face side, you can see this is a 0 day when it is presented to us. Then on the day 40, then this is on day 28, that is day 42. And we have treated this case with the sorinum. Again, these are some of the patients in cows where we are the biggest problem in. Hello, dear friends, if you are comfortable with the cattle also, or only pets you need. Hello.
Sir, all the cases are very wonderful. We will prefer all the cases you want to show.
No problem with the cows also.
Yes, sir. Sure.
Okay. So this is a main problem with the cows. That is mastitis. That is worldwide problem. And with homeopathy, we are tackling this problem very well. So whenever there is a inflammation of the udder, okay, and there is a streaks of blood. These are streaks of red color. So when there is a streaks of red color, like blood color, you can see like that. Then this is medicine. Over here is belladonna. So over here we have given belladonna, brania, and the Artica urens. Cure this case. So ultimately this case is cured. So this is how we take the case of mastitis. Again, this is again streaks of blood over here. Okay. Now see this case. So this is a Gir breed cow. On the left side of the udder, we have this swollen this udder. It is swollen like anything. It is showing it may burst also. You see the position of this cow, and it is very painful to touch with hardness. So over here we have given fatuleka. Then we have given followed by conium mac. So we have cured this completely case. I want to tell you only that how we take the case. Okay, we take the case of old species of animals because in human beings there is only one human, but in animal section We have sparrows also, pigeons also, which are our regular patients. All type of birds are there, whether it is a poultry farm, whether it is a commercial farm. Then avian section is there, totally avian section. Exotic birds are also there. Then we have wild animals also. Like we have treated a lot of this experience in treating elephants also. We have treated this hippopotamus also. So then we have sheep and goats also. Then well, every type of species. You take simply see in case of dogs, there are more than 400 breeds of dogs only. In cats, there are more than 200 breeds of cats only in the worldwide. So every breed had its own characteristics. So we have to like you know the dog of this Vodafone. It is always having respiratory problems because it is a notification location is like that. So we have to take the case like that. Every time we have to take the case individually. So this is the beauty of the homeopathy, that we are getting very good results. So this is again a mastitis case where the udder is inflamed and the milk has come into star colored. It is completely it is not a milk now, it is completely star colored. So we have given arsenical, brania, and merxol separately, one by one, and we have got good results, and the milk is completely like this. Okay, so this is how homeopathy working wonders in the field conditions, and we are applying it not in India only, but in the whole world. So you see over here, this is again this case day first, then day third, this is day fourth. This is how milk is totally cured now. The animal is healed and there is a full milk, and this is the beauty of the homeopathy, that quantity and quality of the milk is retained. So again, you see this is a coliform mastitis, where the milk is the star colored fluid coming from the udder, and we have given homeopathy and the milk converter to full milk. Again, sometimes there are cases in the field whenever the people, owner of the animal, they reported to us, so there is some blood in the milk. Okay, so whenever there is blood in the milk, and in homeopathy, this is the beauty of the homeopathy, that every time we have to check which color of the blood. If it is a pink color, okay, then the medicine is epicac and bufurana. It may be bilifolium also. You see the pink color of the milk in the blood. Okay, after giving this epicac and bufurana, this is completely covered. And if the color of the this blood in milk is dark red, you see over here the color of the blood in milk over here is dark red. So our treatment over here is fast force. So this is, we have to learn from our experience, from our Medina Medica. That's why we every time we prefer that we should read every and each line, each word of the Materia Medica. That we can apply only in the veterinary science. In veterinary science, it's very because our animals can't speak, but they give you symptoms completely. They will not tell you lie. They're 100% natural. Whatever they are, you can observe them. If they are behaving, whatever they pose, they are behaving, you can observe them. You can observe them, what is in their mind, what is going on. Okay, so this is how we take the case. We take every and each minute things into account. Over here, if the color is like this and a red color, and if I have given this epicac over here, the animal have not covered. So every time we have to take the case individually. We have to take other symptoms into account also. Like over here, this is the color of the blood over here is light blood, light red. Okay, then we have given over here, we have to take other condition also, like the cow is very sensitive and irritable. That's why we have given Cabovilla over here. Okay, So every time we have to take the case very, very minutely. This is not a simple thing. There's a blood coming in the milk and we start giving phosphorus, apical, bifurana. No, it's not like that. Every time we have to take PQRS symptom. Every time we have to take LACM, that is location, etiology, concomitant, and modality. Every time we have to take the behavioral symptoms. Every time we have to take the totality of the symptoms. Then we have to reportize the case. Every time we have to find the simillimum. Otherwise, we are not going to cure the case. We are not going to heal the case. So this is our primary duty, to take the case very, very carefully. Again, there are some flags in the milk. The milk is curdled like this. These things are also happening in human beings. So we have taken all these things from data from the materia medica from the human beings also. Then we are applying in veterinary science, because all these things are written in, all these things are experienced by Henneman, Dr. Henneman. He has experienced all these things in human beings. And nowadays we are applying all these things in veterinary science. This is mastitis. Mastitis is also very, very common during those days in human beings also, in ladies. Whenever this udder is swollen and like that, and they are giving there's some of this curdled like structures over there. So over here, but the beauty of homeopathy is we have to check if the animal is eating or not. If the animal is eating very well, the medicines over here is calimere, and the flax over here, the curds or these flax, they are of white creamy color. Okay, that's why we have given calimere. And over here, the flax are yellowish color, and they are smelling a lot also. Okay, so there's edema of the udder also. Okay, and the animal is not eating. That's why we have given Belladonna, Brania, and Urtica urines. So, dear friend, like this, we have to tackle the case every time. Every time we have to find the constitution of the animal. Again, some of the wounds of the cases, as you know very well, we are applying the gunpowder and we are giving glandula internally and externally also. Glandula works wonders in wound healing. These are some of the problems with the teat obstructions. Whenever there's a teat and there are cows which are hard milker, they got some problem at the tip of the teat. So acid nitricum and silicea, they are works wonders over here. Again, this is colitis. This is inflammation of the overall skin of the teat. So this is very, very common condition. And we have given this laxis and glandula. So dear friends, like laxis, from laxis I come to know. So whenever we give the laxis, we take the characteristics, key points of laxis. That laxis works wonders every time on the left side. It is a left-sided remedy. So whenever there is a polygonocyst or luteal cyst or any reproductive disorder problem in the ovaries, if it is on left side, it is laxis. If it is on the right side, whether it is a follicular cyst or luteal cyst, if it is on right side, FPC is medicine. So in the homeopathy, we are applying every and each concept of homeopathy. We are not saying we are simply giving laxis. No, every time we take the minute to minute things. Whenever we give laxis, there is a discoloration, there is some bluish coloration of the area. And this is the beauty of the homeopathy. This is laxis, full laxis, you can say, whenever the animal is suspiciousness. There are a lot of these horses in our field which are very, very suspicious. They will follow you where our owner is going on. And whenever they find time, they will kick you. Suspicious. In homeopathy, well, we have to take case like this. We have to take suspicious into account. We have taken to the left and right side into account. We have to take the smells of this any foul smell, any pungent smell, any egg-like smell, any fish-like smell. So we have to take into account everything. Okay, we have to take history every time. Okay. Again, some teat wounds which we have treated with gunpowder and calendula and treaty. Gunpowder is working very well in animals. So we are giving it continuously. And second, the most used medicine is calendula. Calendula works wonders. So these are some of the pokes type lesions in the cows, on the teats of the cows. Okay. So whenever there are pox type lesions like on the this teats of the cows, we give verolinum. Wonders. We have never failed in this cow pox and these vesicles. Sorry, pox type lesions. Pustules of teats. Give the verolinum 100% coverage. You see from here. These are full vesicles. Okay, cowpox type vesicles and no vesicles after treatment. So this is the beauty of the homeopathy of working wonders. So now again some teat vesicles. Again we give over it antivenicrudum and verolinum. Vesicles. They are pox type reasons. These are vesicles. Okay. Again, so this is teat gangrene. There are good medicines like arsenical and Crotalus horridus. We often use this Crotalus horridus for gangrene-like problems in animals. Whether it is a tail gangrene, whether it is a teat gangrene. Okay, so this is again one of the my applied case in warts. You can see these are all are warts. Okay, you see there are a lot of warts over here. Or completely bunch of warts on the teat side, on the left side, on the behind side. And after taking the case, we have given earlier we have given this Thuza also and other medicines also, but ultimately this case was cleared with the carcinosin because there are warts are too much and this case is carcinogenic. So we have given over here carcinosin and Thuza. And that is why, and after giving all the things, this case is cleared. You see, this case is cleared. But this takes at almost 6 months together to cure this case. Okay, so this is the beauty of the homeopathy. That the animal, we recovered the animals. So again, this is a lumpy skin disease, which is very prevalent nowadays in our India. So we have taken some of the gaushalas into account. We have applied the homeopathy medicines over there. And this is my paper on which we have given some of the medicines, and we have got very good results. This is lumpy nodules all over the body, and ultimately these are covered with some homeopathy medicines. This is lumpy disease. This is gaushala. So, dear friends, I think it is okay, madam. Hello.
Yes, sir. Yes, sir.
Yes, we can discuss now, or if you can take more cases.
Actually, sir, I think we can have the question answer session, sir. I think so.
Let me finish the two slides, then we
Yes,
continue.
yes, sir. Sure, sir. Definitely, sir.
Yes. So this is a homeopathy approach that respects the wisdom of the body. It is an approach that utilizes medicines that stimulate the body's own immune and defense system to initiate the healing process. It is an approach that individualizes medicine. It is an approach that can be potentially very effective in treating the new types of diseases that are afflicting us now and will affect us in the 21st century. So these are some of my papers which are published in the Pub Medicine. Homeopathy as replacement to antibiotics in the case of E. coli, diarrhea, and neonatal piglets. Then wound healing disorder in a horse. Then this is my case that homeopathy treatment of rectal prolapse in kitten. That is International Journal of High Delusions. We have published this case. And again, future of veterinary homeopathy is very better. So nowadays I have completed my advanced certificate in artificial intelligence in digital health and imaging from IISc Bangalore, that is Indian Institute of Science, Bangalore. That's the only one institute in India which is imparting this artificial intelligence with the advanced certificate in digital health and imaging. So over here, we are also integrating AI and ML, and we are integrating in homeopathy, the veterinary homeopathy. And my first paper is also accepted in International Journal of High Delusions, and we are going to present our paper in Slovenia in the coming this November month, in this month only. Okay, so there are some digital health technologies, holistic veterinary care. So how we can proceed a promising future. We have a very good future with the veterinary homeopathy. Our commitment to homeopathy and the role of homeopathy with the AI. Okay, so this is my institute nowadays. That is IISc Bangalore, where we learned this AI and ML from Indian Institute of Science Bangalore. So these are my some of the vets friends all over world. There are some LMHI conference we have in Brazil last time. So all these are vets, and they are DBM people, and after that they are veterinary homeopaths. So we have some association, that is IAVH, International Association of Veterinary Homeopathy. So we have all over the world this association, and I'm the life member of this association. So these are some chief guests over there. This is again one of the conference, LMHA conference in Turkey, Istanbul. So all these are presenters. All these people are. This is president of the IBH. So these are all the senior members. This is again a president also, Dr. David. So these are all the people who are delivered their lectures on this veterinary homeopathy in LMHI conference. So this is how we are working. So this is again one of the conferences in World Integrated Medicine Conference in this Goa, and we have this all the people, this minister with us, and all the people with us, and this is my book on veterinary homeopathy. That is practical handbook on veterinary homeopathy, and this contains from A to Z the medicines. And this is my software, which is I have make you vet laboratory, that is Homeopath Vet. This is mobile app, which is very economical also. This is my this is IVH people. These old people, they are from IVH, that is International Association of Veterinary Homeopathy. These are 16 people from 16 countries. Everybody represents his own country. So thanks, dear friends. So this is AI structure which we have done. These are animals which are get together, and this is before making holy, before playing holy, and after they prayed holy, it comes like this. So this is the beauty of the AI. That is how we make these develop these create these. This is homeopathy for animals. So thank you, dear friends. Now we take some questions.
Thank you,
Hello.
sir. Thank you so much for enlightening us with your valuable knowledge, sir. Dear participants, the session is open for question and answer. You are welcome, actually. Sir, one participant has asked, can we take different repertory for given case during repertorization? This is the question, sir.
Yes, we are taking like that. We are doing like that. We are taking different repertories altogether. So nowadays I'm using this AI tools to conclude all these things. Since I'm an expert in AI, I'm done an advanced certificate, as you know very well. Actually. How to elaborate?
Sir, actually, there is a question. Sir, can you explain the management of foot and mouth disease?
1 minute, 1 minute. Let me. How? 1
Sir,
minute.
could I repeat, sir?
One. How to show my face over here? Hello.
Yes, sir.
To enlarge this one. This one.
Sir, if the screen sharing is completed, kindly just uh, cancel the PPT, sir. I think.
The PPT. Okay.
Yes, yes, sir.
Now it is okay.
Yes, sir.
How to back to tab? Okay. Now it is okay. Yes. Hari, repeat the question now. Hello. Hello. If I'm not audible,
Yes, sir, you are audible.
Yes, sir. You are audible, sir.
Hari, ask the question now. Let me know.
Sir, the question is, sir, can you explain the management of foot and mouth disease, sir?
We are whenever every time we have to take the case like that. If the what is problem? If the problem in the mouth, we will put. If the problem with the mouth, then we have the medicines like acid boric. Then we have medicine like Merksol. Whenever there's a lot of saliva in them. So whenever there's a problem with the food, we have the we can solve those problems with this Merksol also. Then this again Merksol is there, and then again this Natromure is also there. So whenever there's a problem in the interdigital space, then we have the 3C also. So we have to take the case every time. We have to check where the problems are there. So in a family there are a lot of issues, and if we want to redress it as a folk, we are giving acid boric, Merksol all together. We are working very well on this.
Sir, moving on to the next question, sir. What is the software we use for veterinary repertorization?
My small this vet homeopath mobile, vet homeopath, vet homeopath.
Sir, moving on to the next question. If the dog is suffering from fever, what is the remedy?
In the initial stage, if it is if there is a acuteness of the case, then we start with aconite. And if there is some chronicities in the case, then we can move. It may be ferrophas also, it may be belladonna, it may be other things also. So we have to take the case. You can't say if there is a fever and we start giving any medicine. No, this is not like paracetamol. Every time we have to take the case. Okay.
Yes, sir. The next question is, sir, how can we diagnose the mental symptoms of animals?
We can observe the animals completely. We have to observe the animals, then we can come to know how our animals they are behaving. Suppose our animals in an anxiety, so it will show its restlessness. If the restlessness is more, then the medicine is arsenical. And if the anxiety is more and there is the anticipatory anxiety, then the medicine and there are GIT upsets also, then the medicine is argentum nitricum. So this is how we have to observe, we have to take the case every time. We have to observations. Through observations, we can tackle the case.
Okay, sir. Moving on to the next question, sir. Sir, how to select potency for animals?
In simple terms, till date in human beings also there is no decision which potency to give and when. Okay, so in animals like we have some experience, we start with 30 potencies. 30 potencies is always a better potency. So if you want to move further and further, it may be 200, it may be 1 M. But nowadays, in case of these we are getting lot of cases of cancer. The cancer is very much pronounced in dogs and cats, in other animals also. So in those cases, we are using LM potencies also. So nowadays, our main target is LM potencies, which are working very well, like 0/1, 0/2, 0/3, and we can give ultimately from years together. Okay?
Sure, sir. Sir, there are few couple of questions, sir. I have seen a cow in a road, which the body is full with warts in all over the body, and those warts are too big in size. Can you suggest what will be the medicine?
Acidosin 30 for 20, 20, 20 days or 1 month, you can say, twice a day. Then Thuza 200 twice a day, again for 20 days. Alternately.
Yes,
First give
sir.
Thuza, then carcinosin, then Thuza, then carcinosin, like that, like that.
Okay, sir. So this is the last question I feel. Like in humans, for babies, we consider the constitution of the mother also. So for animal babies, we will consider constitution of mother. This is the question, sir.
This is the same question. This homeopathy is applicable for every living organism. This is not for human beings only. This homeopathy is applicable to all living organisms. So same concept is passed in the animals, and rather in animals we are getting very good results rather than human beings, because in human beings they sometimes they tell lie, but in our animals cases they never tell lie. Whatever they are, they are. So we can fetch the symptoms in very nice way. That is the beauty of the homeopathy. Okay.
Yes, sir. Sir, again there is one more question from the participant, sir. Sir, what is the medicine for cows for sensitiveness in giving milk?
That
Sir,
what is your question?
sir, the question is, what is the medicine for cows for sensitiveness in giving milk?
Yes. If it is sensitiveness and irritable, then it may be chamomile also. Then if it is more sensitive, then if it doesn't allow being touched also, and there are some issues with the like abscesses are there and the other issues also there, then it medicine may be hypersol. So every time we have to take the case. So in this case, we are saying the chamomile is the medicine. Okay.
Yes, sir. Yes, sir. Hope all the participants have cleared the doubts, it seems, sir.
So thank you so much, dear friend. Thank you.
Thank you, sir. Thank you so much for enlightening us with your valuable knowledge. Thank you, participants, for your active participation. Thank you, Team Asia, for this such wonderful webinars. Thank you all. Thank you so much. And thank you to our media partner, Homeopathy 360. Thank you all. Good night.
Thank you. So nice.
Thank you, sir. Thank you so much, sir.
Okay, welcome.